Good morning. Welcome to Medical Monday. Dr. B back with the third part of our atopic triad discussion. We talked about asthma last week a little bit, and I mentioned the AeroChamber. And I really wanted to explain this because it's a fascinating device. There's several types. They come in 3 sizes. I only have 2. But they have one for the littler children with a mask that fits on their face. And then they have one for teens and adults that's like this with a mouthpiece. And you take your albuterol and you can just put it in the end of this chamber. And then when you puff it, it will contain the mist. I want to explain why this works. So when I go and I puff my albuterol and you see all those little particles come out, there's big particles and really little particles. The really little particles stay in suspension inside this tube. The big particles hit the walls of the tube and stick. When we just put this in our mouth and we just go, most of those big particles all hit our tongue and our mouth, and the little mist kind of falls back out of your mouth if you're not perfect in your timing and going at exactly the same time that it comes out. The little tiny particles get suspended inside this, and when you breathe this in, they go all the way down into your chest. So when they originally did the studies on this, they found that we get about 3 times more medicine down in our chest when we use one of these than if we just use this. We get 3 times more medicine in our chest, and that means it's going to work 3 times better, and we're going to use 3 times less medicine to get the same effect. So we're not going to run out of our medicine as fast, and when we need it, it's actually really going to help us. So these are a very nice device for when you're traveling, when you're camping, when you're at the soccer field or the football field or playing volleyball or softball, whatever you're doing, your teens and your children can take this with them. It is a great second to the nebulizer machine, which I think you would rely on more if you're really sick, staying home from school, can't breathe, and you're having to do a lot of breathing treatments. Most people prefer the nebulizer machine in that case. But this is your kind of more everyday, especially for exercise-induced asthma, but it's just a wonderful device and very inexpensive, and you can clean it, you can wash it out with soap, and it can last for several years if you take care of it.